mentioned, it's sometimes more difficult to continue having hope in the work that we're doing. We can make a difference. We can reduce our suicide rates. And so as we navigate through today's presentation, I just want to communicate that there's hope for people who are experiencing suicidal thoughts and suicidal ideation, but there's also hope that we can make a difference and that we can reduce the number of suicides that are occurring in Alaska through our work. So keep on mushing. Let's keep doing this work together and stay motivated, because this is a really hard field to work in. So I'll start just by presenting a small amount of data. I don't want to spend a lot of time on it, but just as a basis of where we're at today with our suicide rates. So this right here shows our mortality by year for suicide. So 2010 through 2019, these are the amounts. So you can see the bars show the number of deaths in Alaska by year. So in 2019, you can see in Alaska, there were 209 deaths by suicide. And then our rate is right below that, which is 28.7. And that's the kind of the purple line going across the top. That line in the middle is the US rate. And so you can see that our rates are much higher than the rest of the United States. You can also see that over time, we have had a gradual increase in our suicide rates. And this trend actually is similar to what's going on in the rest of the nation. So Alaska's trends are not different than what we're seeing nationally. So this right here shows us our rates by age. And so you can see that, again, we have the number of people who've died by suicide represented by the bars, and then the purple line shows the rate. And you can see the peaks in our 15 to 19-year-old range and our 20 to 24-year-old range, and even up through 34. You can see the number of people who've died during that 10-year period, and then also our rate. So one of the things that we know is that Alaska has the highest rate of suicide for 15 to 24-year-olds in the nation. We're second in the nation for our overall suicide rate, but for that youth and young adult population, we are the highest. Okay. So this right here shows the results of our youth risk behavior survey. And we've compared years 2013, 15, 17, and 19. And so this is a survey, I think you're all probably familiar with it, that happens every other year and asks high school students a variety of questions. These 4 questions that I've picked out are the mental health indicators. And so you can see the orange represents students who said they felt so sad or hopeless for 2 or more weeks in the past year that they stopped doing their usual activities. Red is seriously considered a suicide attempt in the past year. Blue made a suicide plan in the past year, and then green attempted suicide in the past year. And so you can see each year those numbers have increased. And this definitely continues to communicate to us that we have much work to do in Alaska in supporting our youth and our young adults. Let's see. Do you have any questions about this data? Are you all familiar with this data? Thumbs up is good, because I'm going to start talking about our youth risk behavioral survey a little bit more and some of the protective factors related to this. Hi, Julie. Okay. So in 2019, in Alaska, suicide was the leading cause of death, leading overall cause of death for youth and young adults. And this is the only age group in Alaska where suicide is the leading cause of death. So after after 2019, we moved right into 2020, where we faced a pandemic. So Alaskan youth and young adults were in a vulnerable place already when the pandemic hit. And there's been a lot of concern around how youth and young adults are impacted, and especially our Alaskan youth, who we know are already dying at higher rates than other states. So the Division of Public Health actually did a survey in May to try and understand how COVID-19 was impacting mental health. 58% of respondents reported that their mental health has gotten worse during the pandemic. 30% used alcohol or drugs to cope with difficulty caused by the pandemic. And 33% reported using more alcohol than before the pandemic among households that consume alcohol. So what we know is that these three things in particular are also identified as risk factors for suicide. And so there was a lot of national concern and state and local concern about this impact on youth and our communities. So there were a lot of questions asked during 2020, and still we're reviewing data really closely. It's been challenging to be able to determine whether or not we are seeing increases in suicide, because suicide data goes through a very complex process, and it's really difficult to obtain accurate data timely. So during 2020, we asked a lot of questions and really tried to understand our data, pay attention to our data, so that we could launch prevention efforts to help mitigate the impact of COVID-19. But what we do know, based on our current data, and I say which may be incomplete because through May, actually, we'll still continue receiving data from 2020 about our number of suicides. But right now, we're not seeing, based on the data we have, an increase in the number of people who died by suicide in 2020 compared to 2019. And I'll say that 2019 was a particularly high year, so I don't think that that's saying something amazing, but we do know thus far that our numbers are showing fewer people died in 2020 compared to 2019. And then we also broke that down and looked at youth, because there was a lot of concern that maybe our numbers were the same, but that we had a higher percentage of those people who were youth or young adults who were dying by suicide. And actually, so far, like I said, our data isn't quite complete, but so far it's not looking that way, and that our number of youth and young adults who died by suicide in 2020 did not increase compared to 2019. And I'll just add, losing one person to suicide is too many. And so sometimes it's hard when we're talking about data, because we're looking at trends and we're trying to learn how we can prevent suicide. But I just like to acknowledge that even one person is too many. So during the year, we also looked at the care line. So the care line is our suicide prevention crisis line and someone to talk to line. And it's a resource for all Alaskans. It's a free, confidential resource. And one of the things we noticed is that during calendar year 20, so during the pandemic, we started seeing really significant increases in our call volume. Really starting in July, and July through September 2020 was actually the quarter where we received the highest number of Careline calls that we've ever received in the history of Careline. Similar trend continued in October through December, a really significant increase from other quarters. An increase from the previous quarter, not from the previous quarter, but from previous years during that same quarter. And then one really interesting thing that we noticed was that we also saw an increase in the percentage of new callers. So people who had never used the Careline before were calling it at an increased rate. So you can see on the right-hand side, we were usually around 1,500 new callers per quarter. And then during quarter 2, 3, and 4, it was well over 2,000 for each quarter. So the good news about that is that people are learning about a resource that they have to reach out for help. But what it also tells us is that more people are struggling. And so we know that we've absolutely been impacted and need to provide support. One of the other things that we did was we used CARES Act funding to expand access to the care line for youth and young adults. And so we actually increased one of our services, and it's not fully implemented, but we're moving to 24/7 texting capability. Right now, it's only available 5 days a week for from like 3 to 11. And we really felt like in order to meet the needs of youth and young adults in our state, that we needed to utilize a platform that they are more likely to use. The position also is tasked with following up with youth and young adults who call the care line. And so if someone calls in a crisis, then there's a specific person who will call them back if they agree to it, to follow up to see if they have gotten connected to any resources within their community. They can continue to assess them if they appear to be at risk. And so really what we know is that when we follow up with people, that it actually reduces risk for suicide. This person is also engaging youth to determine how we reach youth. How are they best reached? How can they learn about the care line? How will they most likely utilize the care line? Because what our data has shown us is that although youth and young adults have the highest rates of suicide and suicide attempts in our state, they're the age group that was using the care line the least. And so we have a group of youth and young adult participants who are informing us on how to better reach them. And now I'm going to talk a little bit about risk and protective factors for suicide, because this is an important part of informing us on strategies that are effective in making a difference on reducing some of those risk factors. So when we look at risk factors, and there's multiple risk factors, these are just some of the main risk and protective factors that are identified. There's definitely more than this. And so some of the major risk factors are prior suicide attempts, substance misuse, mood disorders, so depression, anxiety, and then access to lethal means. And that sometimes isn't the most obvious to someone who isn't studying suicide prevention or paying attention because maybe they have a loved one that they're worried about. But we know a lot about access to lethal means, and that reducing that during times of crisis can really make a difference on overall risk. Major protective factors include effective mental health care, so getting mental health care when you need it, connectedness to individuals, family, community, and social institutions. We all know how important it is to have people that you can connect with at school. We hear people saying that their teachers played an important role in their life, and as well as people at church or coaches. We hear that connectedness and being able to talk to a doctor or a behavioral health care provider can make a difference in someone's recovery journey when they're struggling. Another protective factor is actually problem-solving skills. And this one maybe isn't as obvious either, but absolutely within an educational setting, really implementing and teaching youth about problem-solving skills actually plays a major role in protecting them against risk factors related to suicide. And contacts with caregivers. So there's actually a body of research that shows that when a doctor or a mental health provider reaches out after someone has experienced a crisis or a suicidal attempt or risk, or if they're stepping down from a treatment facility, that even handwritten letters and follow-up at specific intervals reduces suicidal risk. And it actually seems really small, but just that reaching out, it's a caring letter, it's a caring contact saying, hey, I hope you're doing well. And it's personalized. So it's usually handwritten, signed by the person that there was contact with. But I found that really surprising. And I think that's not something that a lot of people realize has such an impact. So oftentimes risk factors are confused with warning signs, and it's really important to differentiate that because risk factors really identify when someone is at heightened risk for suicide, but it doesn't indicate immediate risk. And so, someone may have risk factors present, but actually they also might build protective factors that ameliorate the impact of that risk factor. So really, when we look at risk factors and warning signs, we need to make sure and be specific and separate what those two things are. So for instance, a risk factor might be access to lethal means, but an immediate warning sign would be when someone is talking about a plan to kill themselves, or they're expressing that they're a burden to their family. They're talking about no longer wanting to be around. Those are warning signs. And they're very specific to the individual, whereas risk factors can be found in individuals, in communities. And so just very different and important to think about as we kind of move forward in what we're going to talk about today. Risk factors also help target what might need to change in order to decrease risk over time. Not all risk factors are created equal. So today we'll talk about some specific risk and protective factors. But what we know is that high risk for suicide is usually found with a combination of risk factors, and there's multiple risk factors that are present. So it's not just one thing. They vary among individuals and among communities also. So some things that might have a really significant risk factor in Anchorage might be really different in a rural area. And certain people might be impacted more by a risk factor than others based on their personal history and their experiences. Oftentimes there are immediate stressors or tipping points that may create the final impetus of a suicidal act. So a relationship problem, a breakup, financial hardship, legal difficulties, but oftentimes there's a stressor or a tipping point. So one of the things that I want to share today that I think is a really a great new research that has been introduced is a paper that was written by Dr. Charles Utermole and Becky Judd, and they utilized YRBS data and did a new analysis of the data. And they utilized the mental health indicators to show the influence of protective factors. And so the presence of protective factors reduce mental health related risk factors. And so they actually identified a protective factor index. And so and the protective factor index was chosen from different YRBS measurements, but it's based on national research about what we know is considered a protective factor, and it's based on connectedness. And so as I start sharing a little bit more about their analysis, what you can know is that when I refer to protective factors, these are the protective factors that I'm referring to that they base their analysis on. Students would answer whether they agreed or strongly disagreed with feeling like they matter to people in their community, able to control their emotions when they need to, able to remain quiet or extremely calm when things go wrong. They have one or more parents who talks with them about school every day, have teachers who really care and give them encouragement, feel comfortable seeking help from 3 or more adults besides their parents, and they take part in organized after school or weekend activities 2 or more times a week. And then here's the risk factor index. Ever been physically forced to have sexual intercourse, experienced sexual violence during the past year? And I think as you read through them, I'll just say that sometimes when we look at risk factors, it can feel discouraging because we might think, well, we have these risk factors that we can't change. If they've already happened, we can't change how many risk factors they might have. But I think what's encouraging is that what we know is that when we increase protective factors, it ameliorates the impact of those risk factors. Okay. This right here is actually just a snip. So this is not the full, but this is the tables that's in this body of work. And this is the influence of the presence or absence of protective factor. And this is one specific protective factor, the feeling like they matter to people. And it's compared with whether or not youth feel that they strongly agree or agree that they feel alone, that they felt sad or hopeless for 2 weeks or more, seriously considered suicide during the past year, made a plan, or attempted. And so you can see the top line of this is kind of the overall how students answered. So 27.4% of students answered that they strongly agree or agree that they feel alone. 38.1% of students felt so sad or hopeless for 2 weeks in a row that they stopped their usual activities. Well, when they also answered that they feel like they matter to people, the prevalence in which they answered the other mental health questions reduced. So you can see that middle line when the feeling like they matter to people was present, instead of kind of the average of 27.4%, only 14% of students who felt like they mattered answered that they strongly agree or agree that they felt alone. And it's 24.6% versus the 38.1% for felt so sad or hopeless for 2 weeks in a row that they stopped usual activities. And you can see the trend continues, that when students felt like they matter to people, the prevalence in which they answered decreased. And then when that was absent, so when somebody said that they didn't feel like they mattered to people, the prevalence rate of answering those mental health indicators went up, higher than the average. And the reason why I took a snip of this is because actually the table is quite long, but it shows all of the protective factors in the protective factor index. And you can see how much of an impact it had on overall with these particular mental health indicators. So now I'm going to just share a little bit about some of the data. And here is a figure of the prevalence of feeling sad and hopeless among traditional high school students. And this is a comparison with and without the protective factors. So along the bottom, you'll see the protective factors. So mattering to people, the ability to control emotions, the ability to remain calm, and so forth. The orange is the prevalence of that without that protective factor, and the green is the prevalence with the protective factor. And then on the left, you can see the blue, which is the overall prevalence based on that sample size. So with every single protective factor, you can see that there is an increase in, sorry, I'm saying that wrong. There's a decrease in the prevalence when that protective factor is present. You can see some might look like it has a larger impact. So when you look at mattering to people and controlling emotions, we can see that having that protective factor makes a pretty significant difference. Okay, and so this one, indicator is prevalence of seriously considering suicide among traditional high school students. And so this is that same comparison with or without the protective factor. So you can see that students are much more likely to indicate a lower prevalence when they have the protective factor. And I think that is really significant, and it really emphasizes the importance of these specific protective factors, but then also collectively. And then this data, I kind of put them side by side, and I'm sorry if it's hard to see. I wanted to put them side by side because we do have differences in what our alternative high school students report versus our traditional high school students. And so this right here is the prevalence of feeling sad and hopeless among alternative high school students and traditional high school students. So on the left is alternative, on the right is traditional. And this is the number, so the blue bar talks about the overall prevalence, right? So alternative high school students report about 60% of the time, or about 60% of students report the prevalence of feeling sad and hopeless. In traditional high schools, about 38.1% of students report that. So it's much higher in alternative schools. And then the prevalence changes based on the number of protective factors, right? So if you can see, if someone only had 0 to 2 protective factors, the prevalence was a little bit higher. But when their protective factors increased, so when they got to 3 to 4 protective factors, the prevalence was 57.7%, which is less than that average of 60%. And then 5 to 7 protective factors, we see 49.9%. Then you see that same decrease in prevalence as protective factors increase for traditional high school students. And then this right here is a similar figure, but it's the prevalence of seriously considering suicide among alternative high school students and traditional high school students. And so we see the prevalence for alternative high school students is about 40%. And then as their protective factors increased, their prevalence decreased. That was the same in our traditional high school students. So you can see, I mean, I think it's pretty significant when you look at both numbers, but in our traditional high school students, we have a 25.3% of students reporting seriously considering suicide, but when they have 5 to 7 protective factors, it's only 10% of students. And then in our alternative schools, 40% down to 29.8%. And then this right here is looking at it from the opposite perspective. So the prevalence of seriously considering suicide among traditional high school students, and I didn't include the alternative students because it really had the same pattern, which is as the number of risk factors increase, so does the prevalence in which they are seriously considering suicide. And so you can see here, the average prevalence was 25%. And then when you go up, when you have 3 or more risk factors identified in that risk factor index, 60.9% of students with 3 or more risk factors identified that they seriously considered suicide. Okay, so then I think that brings us to, okay, well, how do our students look, right? What is our risk and protective factor distribution? You know, how many risk and protective factors do most students report? And so here, I've listed the protective factor index just for your reference to remind what those protective factors are. And then below, what you'll see is for our traditional high school students, that for 0 to 1 we have about 14% of the people who who took the YRBS, reporting that they had 0 to 1 of those protective factors. And moving right along to 6 to 7% is about 15%. And everyone else is right there in the middle, somewhere between 2 and 5 protective factors. You can see that for alternative high school students, that there was a larger percentage of students who had fewer protective factors than those traditional high school students. And that's consistent with each number. So for our risk factor index, we have similar comparisons. So our traditional high school students, 60% of our traditional high school students report no risk factors. I think that's great. When we look at our alternative high school students, only 34% report no risk factors. You can see that the pattern is pretty similar for traditional high school students and alternative high school students. 4 or more risk factors, about 3.9% for our traditional high school students, and then 13.3% for our alternative school students. So really, what does this all mean? And one thing that I like to share in every presentation that I do is that suicide prevention is everyone's business. And one of the pieces of work that Becky Judd continued to work on after evaluating with Dr. Udamol this data was a document called More Matters, Strategies to Increase Protective Factors Among Alaska Adolescents. And so really what we know is that the more protective factors that a youth has, we're going to see a larger amelioration of those risk factors. And so if we can develop and focus on developing protective factors and getting those in place, we're going to see a reduction in those risk factors. At least that's what our data is telling us. So this is a great paper that talks about how to do that. And it goes into the details about feeling valued and mattering to others and how to promote that in different settings, as well as emotional management and regulation, family connectedness, positive school climate, connection to other positive adults, and quality after school programs and activities. So safealaskans.org has a copy of these bodies of work. You can follow the website links and read about the analysis. The analysis actually does include all of the 67 problem behaviors that are identified on the YRBS, and increased protective factors actually play a large role in ameliorating risk in most of those areas. And actually the reports really go into detail there. So if you're interested in, substance misuse or binge drinking or early sexual activity or any particular indicator on the YRBS and you want to know more about the impact of protective factors on those, I definitely encourage you to seek out these resources. So the other thing, are we okay in time? Yeah. The other thing that I always like to talk about when we're talking about suicide prevention is that means matter when it comes to suicide prevention. We know that, for instance, in Alaska, the number of homicides versus suicides from 2013 to 17 for youth and young adults, we had 59. But how many suicides do you think we had? The same? A little bit more? So we had 230 suicides. And then when we talk about the method or the means, for homicides, 47 out of 59 of those were by firearm. And suicides by firearm, we had 149. So really what we're looking at is about 62 to 65% of suicides in Alaska are by firearm. So one of the reasons why means matter is because firearms are the most lethal and most common suicide method. They're almost always fatal. And if there are other methods that are attempted, they're much more likely to not result in someone dying. And then I think a really important and hopeful thing to remember is that 9 out of 10 people who survive a suicide attempt do not go on to die by suicide later. So that's a real common myth, that if somebody wants to kill themselves, they're going to find a way. But that's not what research tells us. And so it is really important that we educate people on how to separate a firearm from a person who's experiencing a crisis or suicidal risk, even temporarily, because it increases their chances for survival. And so when I say suicide prevention is everyone's business, there are ways that we can do this in our personal lives, within our jobs or our roles, whatever that might be. And that is to share with people what we know about that. So if you have a friend who has a spouse or a child or a friend who is struggling with a crisis and they're really worried about them, ask, do you know if they have any firearms in their home? And if you do, I know, everything might be okay and they might get the help that they need, but do you want me to store your firearms in my home, or make another recommendation that could work for them, and talk about the risk of having a firearm in a home. It's not a very common conversation to have, but we have youth who are stepping up and having conversations with their peers when they need to, and it's absolutely something that we can do too. So by working with family members and care providers to reduce someone's access to firearms, it helps ensure that more people get a second chance. Sometimes I share a story about a suicide attempt, and I'm not today just because we're in a virtual environment, but sharing that information with a family can allow them to take action. And so then if someone does still attempt suicide, may not be with a lethal method, and can give someone another chance. So this right here is something that's developed by PC Cares, and it talks about how 10 minutes can save a life. So research shows that making it harder for someone to find a loaded gun, a private place, pills, a bridge, alcohol, a snow machine key can save a life. Even a few minutes delay can prevent suicide. And so this is a great map of a home and the different things that you can do to safeguard your home if you have someone in your home who's struggling. And PC Cares has a website, so you can access this, this handout on the website if it's something that you'd like to use. And then the last thing I just wanted to say and share is that we can be the light, and we can do this work. And Sharon Fischel made these beautiful posters as resources for all of us. So thank you, Sharon, yay, it's beautiful. But this is hard work, but it's definitely work that we can do. And so I think we just need to continue approaching it with hopefulness, and reaching out to each other for support to do it as best we can. And so if there are any questions about any of the research that I shared, or any of the material, we have time to talk. It's a little bit early, actually.
I guess I'll also add in, again, Lori Price. I'm sorry, I don't think I introduced myself in the very beginning. I realized I jumped from one webinar to the next. If you guys are interested in live CEUs for attendance, please add your name in the chat, and then also email Cami Moore. I included her email in there. So just to let you guys know, and awesome job, Leah. This was really great information. I really enjoyed your presentation, especially learning that new resource from Charles Uttermore as well.
Yes, thanks, Leah. This was great. And just to clarify, the CEUs for this year are just for LPCs.
Yeah, I think that there's a lot of national research around protective factors, but I think it's really excellent to have an analysis of our Alaska data that absolutely shows how protective factors and building those protective factors can have an impact on mental health. I think it's a great source of data to utilize to support funding, to support strategies that you implement. In your classrooms, within your roles. I know everybody might be doing something different. I'm not sure of everybody's role here, but it's building connectedness is something that we can all do, and I think that's the difficulty when we talk about suicide prevention is how do we do that on a personal level? How do we do that at a community level? And how do we do that within our jobs, with our coworkers, with our friends? So I think if there's anything that I'd want people to take away today is that each one of us can do that. And I think with that, if there's not any questions, I think we can end early and we can have 20 minutes of our day back.
Thank you, Leah.
All right. Thank you guys very much.
Good job, Leah.
Thanks, Sharon.